Assalamualaikum warahmatullahi wabarakatuh. I'm Dianita, lecturer from the School of Nursing Department in Universitas Muhammadiyah, Yogyakarta. And today we're gonna talk about information and communication technology. As working parts of the nursing center, informations and communication technology would be a very important part to communicate with the colleagues and also the patient and even the patient's family. And now we would like to take a look in details what is information and communication technology on nursing care. So here I have prepared some slides on information and communication technology on nursing care. So what is actually information and communications? If you have a long experience of interviewing with the patients and maybe with the patient's family, that's included in communications. And information technology is how you will create and also develop all the results data of the informations to the patients and to the healthcare. So I would like to explain first about information and communication technology. This is the ICT, usually is refers or abbreviated as the ICTs. And this is refers to all the technologies that provide access to informations. I think and I believe that all of you have already having your mobile phones and even computer and also others information devices that you have familiarly used in your daily life. We will focus on primarily on communication technology, on how to use technology itself to communicate with the patients and also to delivering care in the hospital and also in the nursing care. This includes all the internet, the wireless network, the cell phones, and other communications mediums. We might be also using the internet to gather the information from Facebook, for example, or also from the other social media that we could benefit to communicate with the patients. So, this is the general purpose of the ICTs itself. First purpose is to support the healthcare delivery. We know that some cities may be experiencing of a wide range of geographical setting. Some people or some patients may be live in the rural areas and some of them may be live in the urban areas. And how to support the healthcare delivery is very important to think, especially how you deliver all the information on healthcare to your patients. And the second purpose is it will be also support how you as the nurse plan, deliver and also documents all the nursing care. It is widely used also as the nursing care plan using a computerized system in the hospital to enter each of the data from the patients, from the things that you gathered from the interview for their family, and then you will input it into computers, and the computer will be directly connected to all the hospital wards and even all the institutions reaching the healthcare information systems. It might not be just providing the information for a hospital, but it will be and possibly connect from the one hospital, which is hospital, or for one hospital to the primary healthcare in the community settings. And the third purpose, that nurse receive and review diagnostic informations, make clinical decisions, and also communicate and socialize with patients. This is an important and critical thing when you working with the patients, is also to work with their family, to communicate with their family on how the patient's care is running on. They should be also involve the relatives, for example, in how to telling the information from the patients and the condition from each of the patients in the hospital or nursing care. And the way on the nurse receive review diagnostic is also a critical care in nursing care. It means that you need to receive all the valid data informations. For example, if you conduct a telehealth medicines with the patients from the rural area, for example, you have to make sure first how is the telephone connection, for example, or how is the data connection, for example. So you could make sure that your patients could access the internet to gather the data. And now we will be turned on domain of e-health on ICTs. It is a lot of aspect covered what is ICTs do for nursing care. The first is the management system. As I talked before, it is included in how you document the nursing plan, how you document each of the interview data from your nurse and also from the family, and then collect it into one system, one management system that you will be distributed with the other nurse, the doctors, the nutritionists, the pharmacists, and also anyone that might be helping you supporting a nursing care. The management system will be manage all the informations based on the important or the need of each professions to know how or what is going with your patients. For example, the nutritionists might assess how your patients intake and also output on the nutrition or food and even the fluids, for example. The second domain of e-health on ICTs is the communication system. It is specifically consists of how the communications will deliver to the patients and also the family patients. As the example, one of the examples, I ever conducted a focus group discussions into or through the Facebook to gain more awareness on the smokers to stop quitting smoking. And this is really work because we approach the young, which usually they are so familiar with the social media, use the Instagram, Facebook, is really potential to help us to gather all the information from the patients and how to motivate them to use all the information in health. But using communications and also social media, website and others health resource in the internet, we must be aware on the digital literacy. It is on how we obtain the information from the internet, from the website, and analyze it and use it for the wise concerns on health. So digital literacy will be diminished of the existing of hoax or the false informations. The third domain of e-health on ICTs is computerized decision support system or CDSS. This is usually a developed, well-maintained system within the university, for example, or within the hospital to help the students and also to help the lecturers and even the nurse, the practitioner nurse, to use all the support of the applications that planting on the internet or in the computer or even in your smartphone. You could also utilize computerized decision support system on the smartphone, for example, in the form of applications. So lots of applications that we could also utilize to support the nursing care for the patients. For example, on how to obtain BMI and how to obtain a concise numbers of BMI for each patient based on their activities, daily activities, their intakes, and also the age, for example. The last domains of e-health on ICTs is the information system. This is include the web-based resource and e-health portals. So this is usually in the form of journals and also the research proceeding, the research conference, and the others health information that we could use for or to decide on how to give a good and also excise service for the patients. So on how you could give best nursing care for the patients, we are fully aware that now are a digital era, the 4.0 era, the industrial era, that you also have to pay lots of attention on how to use technologies in your nursing care. So thank you for today's lectures. Hope it will be bring beneficial, important messages on how to use the information system on nursing care. Wassalamualaikum warahmatullahi wabarakatuh.